As Dr. Michael Hayes, I have spent decades in exam rooms, and I can tell you that the most dangerous part of your medical appointment isn't the blood draw, the scary-looking machines, or even the physical exam. It is the communication gap that often exists between a patient and their physician. We live in an era of high-speed medicine where the average doctor's visit lasts only 10 to 15 minutes. In that tiny window of time, every single word you say acts as a filter for your doctor's diagnostic brain. If you use the wrong phrases, you inadvertently give your physician permission to stop looking for the root cause of your pain or discomfort. As we cross the age of 60, many of us fall into the trap of being polite patients. We don't want to be a burden, we don't want to complain, and we certainly don't want to sound like we are falling apart. However, this modesty is actually a significant threat to your longevity and your quality of life. When you use certain vague or dismissive phrases, a phenomenon called age masking occurs. This is when a doctor hears your symptom but attributes it to your birth year rather than a treatable medical condition. In this video, I'm going to pull back the curtain on the 5 specific things you should never say in an exam room and show you exactly what your doctor hears when you say them. By the time we are done, you will have a new vocabulary for health advocacy that ensures you are never ignored again. Before we break down these phrases, I have a quick request. Please hit that subscribe button and give this video a like. Your support allows us to keep sharing these critical health advocacy tips with seniors all over the world, and it ensures you stay informed about how to navigate the complex medical system with confidence. Now, let's get into why your choice of words is your most powerful medical tool. The number one phrase that makes me cringe as a physician is when a patient looks at me, shrugs their shoulders, and says, "Well, doc, I guess this is just part of getting older." I understand why you say it. You've been told by society, the media, and perhaps even other doctors that after 60, your body is simply supposed to hurt, your energy is supposed to vanish, and your memory is supposed to naturally fade into the background. But from a clinical perspective, that sentence is a white flag of surrender. When you say it's just aging, you are essentially giving your doctor a psychological out. Medicine is, by its nature, a process of elimination. If you provide the explanation for your symptom yourself, many doctors, who are often overworked and rushed, will subconsciously accept your diagnosis and move on to the next patient. If you tell me your knee pain is just old age, I might not look for the localized inflammation, the early stage osteoarthritis, or the meniscus tear that could be fixed with simple physical therapy. If you tell me your exhaustion is just slowing down, I might miss the iron deficiency anemia, the vitamin B12 deficiency, or the hypothyroidism that could be treated with a simple daily supplement or pill. We must stop normalizing symptoms that are actually warning signs. For example, many seniors dismiss shortness of breath as getting out of shape, when it could be the earliest warning sign of congestive heart failure or atrial fibrillation. Persistent sadness is often labeled as grumpy old age, when it is actually clinical depression. Balance issues are dismissed as clumsiness, masking neurological issues that are not inevitable. What you should say instead is focused on function. Move away from feelings and move toward performance. Instead of saying you're tired because you're 70, say, 3 months ago, I could walk up the stairs without stopping. Now, I have to stop halfway to catch my breath. Why is that happening? This presents a clinical puzzle that demands an investigation. It tells the doctor that your current state is abnormal for you, regardless of your birth year. Never accept a "it's just age" answer without a diagnostic test to back it up. The next phrase on our list sounds like the answer of a model student, but in a medical setting, it can be a recipe for disaster. I'm taking everything exactly as prescribed. As a doctor, I know that life happens. Maybe a pill makes you feel nauseous, so you skip it. Maybe the cost of a brand-name drug is too high this month, so you've been stretching your supply. Or maybe you simply forget a dose here and there because your schedule changed. Many seniors tell this white lie because they don't want to be judged. However, this is one of the most dangerous things you can do to your heart and kidneys. If you tell me you are taking your blood pressure medication perfectly, but your blood pressure is still high when I check it, my logical medical conclusion is that the current dose isn't strong enough. I will likely increase your dosage or add a second medication. This creates a toxicity trap. If you eventually start taking that new higher dose exactly as prescribed, your body might be hit with a massive amount of chemicals it wasn't prepared for, leading to fainting, dangerously low heart rates, or kidney failure. Doctors aren't the police. We are your partners. We need to know the real-world version of your medication routine. Instead of the perfect answer, try saying, "To be honest, I've been skipping the water pill because it makes me run to the bathroom too much when I'm out with friends." When you are honest about why you aren't taking a medication, it allows me to find an alternative that actually fits your lifestyle. Coming in at number 3 is a phrase that I hear almost every day. I don't want to bother you with the small stuff. While this comes from a place of kindness, it is completely counterproductive. In medicine, we often talk about the first domino. Most major medical crises, whether it's a stroke, a heart attack, or advanced cancer, don't start with a loud explosion. They start with a tiny, small change that feels insignificant. When you withhold these details, you are hiding the first piece of the puzzle. A tingling toe might seem like cold feet, but it could be the first sign of peripheral neuropathy or type 2 diabetes. A slight trip might seem like clumsiness, but it could indicate an inner ear issue or early Parkinson's disease. I want to pause here and ask you, what is one small symptom you've been noticing lately that you haven't told anyone about? Please share it in the comments. Your comment might be the push someone else needs to finally call their doctor. The best way to handle this is to bring a written list of these minor changes. Say, "I've started a list of small changes I've noticed since our last visit. Should we be concerned about these?" This allows the doctor to quickly scan them and decide which ones are signals and which ones are just noise. The 4th phrase is the most frequent lie told in medicine. "I'm fine." We are socially conditioned to use this as a greeting, but when you are in an exam room, this reflex is your enemy. You might have been raised with a stiff upper lip mentality, but that modesty creates a social mask. If the first thing you say is that you're fine, my brain subconsciously checks a box that says, "No urgent issues here." And we might spend the rest of the visit talking about things that don't actually matter to your health. Many seniors smile through the appointment while their internal health is suffering from chronic stress, isolation, or grumbling pain they've simply gotten used to. The goal of your appointment is to identify areas for improvement. You should lead with the truth. Say, "Honestly, I've had better months. I've noticed my energy is lower and I'm having some trouble with my sleep. I'd like to focus on that today." This sets the agenda and ensures your real needs are met. Finally, we reach the number 1 thing you should avoid. "I saw this on the internet, and I want you to prescribe this specific drug." While I love patients who take an active interest in their health, there is a massive difference between being informed and being self-diagnosed. Leading with a demand for a specific brand name medication triggers a defensive response in your doctor's brain. Pharmaceutical commercials are designed to make you feel like their pill is the missing piece. But they rarely emphasize how that drug might interact with your existing heart medication. When you ask for a specific drug, you are skipping the diagnosis. If you want a specific pill for joint pain, I might focus so much on the drug that I forget to ask why your joints hurt in the first place. Instead, share the information you found without demanding the outcome. Say, I read about a new treatment for my condition that has fewer side effects. Do you think something like that would be safer for me? This opens a dialogue rather than a negotiation. To wrap up, remember that your doctor is a tool, and like any tool, they work best when used correctly. The phrases we discussed today build a wall between you and the care you deserve. Your new advocacy protocol is simple. Bring a written list, focus on your function and what you can no longer do, and be brutally honest about your habits. I hope this guide helps you feel more empowered the next time you sit on that exam table. If you found this information valuable, please subscribe, like this video, and share it with someone who might be too polite at their checkups. Your voice is your most powerful medical instrument. Don't be afraid to use it. Disclaimer: this video is for educational purposes only and does not replace professional medical advice. Always consult with your healthcare provider regarding your specific medical conditions and medications. Never disregard professional medical advice or delay in seeking it because of something you have heard in this video. Take care of your health, and I will see you in the next one. Translation: everyday English for easy understanding. When you talk to your doctor, avoid saying things are just because I'm old. This makes the doctor stop looking for real sicknesses. Be honest if you aren't taking your pills. If you lie, the doctor might give you a dose that is too strong and dangerous. Don't hide small problems like a tingling toe, because they could be signs of something big like diabetes. Don't say, "I'm fine," just to be polite. Tell the doctor what really hurts. Lastly, don't demand a specific pill you saw on TV. Instead, ask the doctor if that new medicine is safe for you. Use a written list to stay organized.